Your perineum is the area of tissue between your vagina and your anus, and it connects with the muscles of your pelvic floor. Your perineum is simply amazing. Like your vagina, it's built to stretch and accommodate your baby being born. Think of both your vagina and perineum like an accordion. They can expand and they can retract. It's funny how we worry about this expansion and contraction. Do we worry about the effects of the male erection? Do we panic that it will never be the same size once it returns to its usual size and state? No, of course not. However, the biggest fear about giving birth for most people is whether they will tear or not, which is absolutely reasonable, given that this is an intimate area. Approximately 85% of those giving birth will have some degree of perineal tear during vaginal birth. There is good news though. Yes, there are plenty of things you can do to protect this area and to make the perineum more able to stretch and baby pass through without trauma. Before we discuss these though, I would very much like to state that the vast majority of tears in birth are so small that people don't notice them happening, especially as you will have just birthed your baby. And the vast majority of tears will not even require a stitch, as they are far better off healing on their own, as would any small cut or graze on your body. Also, even with the larger second or third degree tears, as the cells of the perineum are flooded with the hormone relaxin, which enables it to fan open, the pressure of the baby's head reduces circulation, thus numbing the area. So people with larger tears still do not feel this happen. So what can you do to help? Firstly, you could try Perinel Massage. You can start this anytime from week 37 onwards and can easily find visual instruction by just typing Perinel Massage for birth into Google or into YouTube. I would suggest that both you and your birth partner get involved, assuming that you are intimate with your birth partner, as it can be a tricky manoeuvre to accomplish solo when heavily pregnant. Use an unscented natural massage oil or buy a specific oil for perineal massage. If doing it manually is tricky or you feel uncomfortable doing so, then possibly think about investing in one of the products created for this purpose, and there are a few on the market. These can be purchased online from the manufacturer, who will also have useful tutorials and videos on how to use them. Some of these are dual purpose. Firstly, so that the user can learn to stretch the perineum in preparation for birth, and secondly, to strengthen the pelvic floor by aiding in your pelvic floor exercises. No, they're not cheap, but many people who have given birth swear by them. It's recommended that you start using either Perinel Massage or a product such as an Epino from around week 37 onwards. But how about a differing argument? Okay, Perinel Massage is optional and there is scant evidence that it actually works. It's fair to say that the perineum is really only built to stretch to give birth once every 10 months at most. Are we creating micro tears to the area by attempting to stretch it in advance? When we suggest that a pregnant woman does perineal massage, are we saying that the perineum is flawed? Are we saying that our bodies are flawed? Are we just selling products? Only you can decide the answer to this, and only you can choose what works best for you. So what else can you do to help protect your perineum? You may like to consider using a birth ball. This helps with optimum positioning and helps to soften and lubricate the perineum. Also remember that as soon as you feel the perineum stretching, sometimes referred to as the ring of fire, then breathe softly and let your body do the work. Do not actively start to push at that point. This way, you will give the perineum time to stretch on its own. In effect, be ready to softly breathe your baby out. And of course, positions for birth. As we already mentioned, UFO, upright, forward and open, create the space needed to birth your baby. If post-birth you are looking after a perineal tear, you'll find it helpful to take a bottle of water into the bathroom with you when you go for a wee. You can then pour the water over the area as you urinate to water down the acidity of the urine and stop any stinging. You can also find out online how to make a padsicle by pouring water, lavender and tea tree oil over a maternity pad and then freezing it. This will help to cool the area and reduce pain and swelling. I know this is a tricky conversation to have when pregnant, but it really does pay to be prepared and to know and understand your own body.